the nursing home can turn you into a terrible nurse, all right? These nursing homes will make you lose your license. I'm not gonna tell you to walk away from the nursing homes. I'll never tell you to do that. But I will respectfully tell you to run. Run away.
But the care home here is a no-go area personally, because care homes here, you find you're the only nurse, and then you'll be taking care of about 35 to 40 patients, if not more than. So it's demanding here. And also,
there's a video going around in the nursing community, and most people seem to say that it is easier to lose your license or to get your license as a nurse revoked in a nursing home than it is in the hospitals. What is your opinion on this? Honestly, I have said this in a video of mine before, that I think you're more likely to find yourself in trouble in a nursing home. And I have done a survey on my community page before, and lots of people were saying that you can lose it anywhere. And most people also said that it's more likely to be lost in a care home. What do you think? Today, we're going to look at this gentleman's video, and then we'll see why he thinks that it's easier to lose your license or to get your license as a nurse revoked if you are a care home nurse. Stay tuned. So hi guys, this is not to scare any care home nurse. This is not to get every care home nurse resigning and moving to the hospital. Not at all. For those who are not nurses and do not even understand what this debate is all about, let me quickly explain what a nursing home is or a care home is versus a hospital. So personally, I have worked in a nursing home for over 5 years. I worked in a nursing home for about 5 years, 6 months, and then I'm currently working in a hospital. So I have had a taste of both in the UK. But for those who haven't, I'm sure you know of nursing homes. So basically, nursing homes or care homes, like I said, is like a homely environment. I mean, usually you're taking care of people who are not acutely ill. Usually you're managing sort of like people with, let's say, dementia, or people with some chronic conditions like, let's say, Parkinson's, or let's say diabetes or hypertension, or the aged people who are frail and who are not able to take care of themselves. And you're just basically assisting them with activities of daily living. You're assisting them with taking of their medication, because let's say they are pleasantly confused, or they are old and they require help with taking of their prescribed medication. Some of them are weak and not able to move, so they require people to help them with movement, even in the bed, to turn them from one position to the other. Some of them will need help with feeding because they are on certain diets, and they are too frail to feed themselves. They cannot cook themselves, so they'll need help with that. Some of them will need continence care. I mean, with people to change their diaper and clean them, to bath them, dress them up, to maintain their skin integrity by preventing pressure ulcers, to help them with their religious and spiritual needs, and all of that. So usually that is what we do in a nursing home. I mean, so we can have nursing homes that only have people with learning disability, or people with dementia, or people with some sort of nursing need. In the nursing home, we don't even call the people that we take care of patients. We call them residents. They reside in their homes. We are basically just going there to take care of them. And so, like I said, it's like a homely environment. I mean, and usually there are no doctors in the nursing home. If there's an emergency, you either call the ambulance or you call the GP on the phone for advice. So basically, that's the nursing home for those who do not know. When it comes to the hospital, I'm sure most people know what the hospital is about. So I'm not even going to explain much about the hospital. You know, right? So why are people saying that it's easier to get your license revoked in the nursing home than in the care home? For me personally, I think that there is a possibility. Let me give you an example. So I used to do the night shifts in a nursing home. I love night shifts. I love it. So I used to work night shifts in a nursing home. And usually in the nursing home that I worked, right, there were just 2 floors, the dementia unit and then the nursing unit. If you are on the nursing unit, you were the only nurse in charge of, I think, 24 residents. And if you are the dementia unit, you're the only nurse in charge of 15 dementia residents. And there's no manager at the time, it's just you and the carers you have. And you can have 2 carers. Sometimes some carers will even call in sick and then you're short of a carer. So it can be, let's say, just 2 people on a whole floor with 25 people to take care of. Or let's say 3 people, if everybody comes to work, 3 people, on a floor with 25 residents. That can be tough, So we all know that they are not acutely ill. They don't have urgent medical needs at the time, but anything can happen. And as a nurse, if you are not able to manage this well, you're not able to prioritize, you're not able to recognize deterioration early or recognize a medical emergency, that can cost you your license, should it become a big issue and you're sent to court because there is no other person. However, let's say the opposite is, let's say in the hospital, there are so many nurses. You can never be the only nurse on duty in a hospital. What kind of hospital is that? So there's always sort of like a second opinion. If you're not sure of something, somebody to go to. Even when you go on your break, there's somebody somebody to cover for you. And then there are senior nurses and there are doctors. You know, there are doctors. If you're unsure of anything, the patient seems to be turning blue. Quickly, you call the medical team. The patient is this. Quickly, you do this, right? So there's always sort of like somebody else to lean and to share responsibility. Even if you've been assigned these patients and you're not sure of something, you can always call a senior nurse, right? But you don't have that readily available in the care home, and I understand why. I once took a shift. I told myself I will never go to that care home again. In a nursing home where there were about 34 patients or 34 residents, right? And the thing is, they were not all in one area. About 10 of them were in a separate locked unit, another 10 or 12 were in a separate locked unit, another 10 or 12 were in a separate locked unit. And when I finished my medication that night, it was after midnight. Honestly, it was my first time working there and it was my last time, or probably my last time going there. Such a place. So imagine, I don't know, all these residents, about 30 people that I have to give medication to. Some of these people have about 12 different medications to receive. You have to make sure you're giving these medications, you know, make sure that, you know, and then you're doing all your right checks and you're giving this medication. And there's somebody probably who needs, let's say, a very critical medication at, let's say, 10. And let's say the person who handed over to you did not hand over right. And you get, let's say somebody has Parkinson's medication to receive. It is difficult, you know. So I understand where this nurse is coming from. I'm going to play some of the scenes, right? Or some of the stuff that he said. And then we can all, you know, debate about it and talk about it. So I understand why people say that. So when I first moved to the NHS, I was discussing, you know, care home with one of the nurses there. I was telling her of, you know, months where I could get £3,700 per month and all of that. And she was shocked because I saw this very intelligent nurse having to work so much because the NHS salary is crap, right? So I was telling her that, why don't you go to the NHS? Look at me trying to tell somebody to leave the ED to go to the care home. I was like, why don't you go there? So I showed her my pay slip from, let's say, 2019. You know, I was like, I had just come to the UK and I was making 3,000. I was making this. She was shocked. And then she goes like, but you have about 20 people to give medication to, right? I'm like, is that your worry? You are so intelligent. That's not really a problem. But I understand why she is concerned, because you're responsible for so many people. And I think that that's another reason why care home nurses are paid a bit more, you know, because you're responsible for so many people. The maximum number of patients I've ever had in the NHS ever since I've been working there is 6. That is manageable compared to 20. And like I said, I've worked in places where me alone, I have to take care of 35 and I'm the only nurse. And sometimes if you're not able to think on your feet, you can get into trouble. For instance, I went to work in this nursing home. They were short-staffed, right? And they were so desperate. They needed me to come and work. So I went to work. I was off that day from my main job and I went to work there. So I was chatting with the carers and then they were like, we have a permanent staff nurse, but something happened. So she's currently under investigation. And I was like, oh, what happened? Why is she under investigation? They said, so there was an emergency. One of the residents got seriously ill and she phoned the paramedics. But what she forgot to do was that when she assessed the patients, the person's SpO2 was like below 80 and she was panicking because there were a lot of things to do. You know, I think the person needed to be suctioned and a whole lot of things. She forgot to put up oxygen, right? So obviously when the paramedics came, they also have to write a report and the person nearly lost his life. This resident nearly lost his life, right? And the paramedics were sort of like shocked that the nurse did not think of putting oxygen, you know, to get the person to breathe. What happened to the ABCD, you know, and you did not think of doing that. So they reported the nurse and she was under investigation. She had to go through a lot of, you know, what do they call those things? Trainings and all of that, plenty things, right? And so that was why. And that can easily happen to anybody. I've even seen care home nurses be in trouble because paramedics came to transfer somebody to the hospital and the person had a soaked incontinent pad, you know? So there is a lot of things, right? There is a lot of things. And another thing is that in nursing homes, we're usually taking care of people who are, let me say, at risk, vulnerable people. So you can easily fall into trouble when it comes to that. So I understand where this person is coming from. Let us watch the video.
Okay, all right. And as you guys can see in the title, working at the nursing home can turn you into a terrible nurse, all right? And I feel like out of everybody on the internet, I have the rights to talk about this because I actually work at nursing homes. Matter of fact, I started my nursing career as an LPN, okay?
So this is a video of a USA nurse who is a male nurse who was an LPN before. So for those who don't know the US system, an LPN is a licensed practice nurse, I believe. So they do have some form of nursing education, but they are not registered nurses. They are a bit lower than registered nurses, for lack of a better word, right? And when this nurse was an LPN, he used to work in a nursing home, the same nursing home, right? And now he's gotten his license and now he's working in the ICU. So these are completely opposites, you know, settings to work in. So from an ICU to come and work in a nursing home, and he said he could not, he had to resign immediately. And I don't know if he reported the nursing home, right? So some of his concerns were that, one, the ratio. I think another thing with the US is that the nursing homes in US are quite populated. You can get like 60 patients to like one nurse, and he did mention this in the video.
You see, in the ICU, I count the follicles on my patient's head, right? I got a lot of time to do that, and I only got 2 patients. So they're getting a deep, deep dive, all right? I'm doing the most in-depth head-to-toe assessment. You can't do that working at the nursing homes when you have 40 to 60 patients, all right?
And another thing he said was that because of the workload, it's like there's so much to do for 60 patients. The nurses end up using shortcuts, okay? And that can happen to anybody. So one thing that was very dangerous that he said they were doing, that he said in the video, these are not my words, is that the nurses were giving the medication in one shot. So let's say somebody has metformin, which is a diabetic medication, at 9 and at 5 p.m., for example, these nurses were giving the person's medication all at once.
Because you got to think about it. How can you finish all those meds, 40 patients, right? And take a break, an hour-long break, and go home early on top of that? Guys, some of these residents are getting their daily meds in one shot, right? One shot.
And even if it's not the same medication, right, and you are giving all at once, have you thought of the drug interactions? Because you are a nurse, you're not a pharmacist. You don't know that there's a reason why the pharmacist or the doctor prescribed them at separate times and not together. So you giving all of them together, have you considered the drug-to-drug interactions with these medications that you're giving them all at once? And these nurses are doing shortcuts just so that they can be quick, because how else can you take care of 60 patients, right, and finish and go home early? And the shortcut part is very true. I mean, I have seen, people in nursing homes where, let's say, somebody requires a hoist to be used to move the person because the person has been assessed not to be good on their feet, blah, blah, blah. But you look at how long it takes you to get the hoist, put the sling on, do this, do that, get 2 people. So says, let's say, rather, get the person through the arm and then move the person. And that is in less than 3 seconds to be able to do that. Let's say from the chair to the bed, and they are done, right? I've seen carers do that. And this is bad. And it's because they have to put 20 more people to bed. You have to transfer 20 more people using different devices. They are, in a way, going to find shortcuts, which can be fatal. It can be costly, So these are some of the things that are with nursing homes. And then he did mention that you can easily turn into a terrible nurse in a nursing home. And I agree.
Working at the nursing home can turn you into a terrible nurse, all right?
Especially if you work in a nursing home where people are so used to shortcuts and they are not following the book. And I've said this in one of my videos that if you go to a workplace where you realize that everybody is doing the wrong thing, you're more likely to also start doing the wrong thing because everybody's doing it. They do it so much so often that it tends to look like the right thing, So for example, in my workplace now in the ED, right, the girl who did my induction, one of the nurses, she would go to a patient 7 times. She would confirm name, date of birth, allergies, pain. When I was doing my induction, I'm like, oh my God. We all know she's called Nanelle. You asked her 2 seconds ago, she told you she's called Nanelle. It's on her hand. You asked her, she said she doesn't have any known allergies. This girl will ask, can I confirm your name and your date of birth? In a nursing home, look, I know my patients. Some of them I've cared for them for 5 years. I know that this person is constipated even before I check the record of the bowel movement. I know, I can tell. I know that this person is acting this way because they are thirsty, even though they've not verbalized it. I know that this person is asking this way because they are constipated or they are hungry. I know my residents so well. So I don't remember ever in my nursing home going to ask your name because I am so used to them. So that was so new to me. And she will go back 4 times to the same patient and she'll confirm everything. Right. So I am also learning and I have found myself asking that as well. And I am so proud of myself. I feel like I'm doing my Oskies all over again. But it's because my hospital, the nurses there go by the book. I'm not even saying this because I'm currently there. But if you find yourself in a place where people are just doing things, you will end up doing same as well. So if you find yourself in a place where people are doing illegal things, it's only time that you guys will be caught and reported. Leave that place before you also start doing the negative things. Leave immediately. Rather go to the place where they do the right thing, which is difficult. They go strictly by the book, which can be so annoying. And you find yourself also becoming so used to doing the annoying things and it becomes a habit than, the other way around. You get me? Right. And then another thing he said was that you cannot really properly assess your patients. Right. And this is so true.
You see, in the ICU, I count the follicles on my patient's head, right? I got a lot of time to do that, and I only got 2 patients. So they're getting a deep, deep dive, all right? I'm doing the most in-depth head-to-toe assessment. You can't do that working at the nursing homes when you have 40 to 60 patients, all right?
He said when he first went, right, because there's so many of them, how can you properly assess them? And I remember when I went to the ED and I was now really focusing on checking my blood pressure before I give any blood pressure medication. I've been there 2 months and already I have corrected doctors on blood pressure medication like maybe over 3 times already, because now it has become a part of me. I don't remember doing that in the nursing home where I would check every single person's blood pressure before I give them their BP medication. I wasn't doing that in the nursing home, but now I'm doing that, and there have been 3 or more instances where this person has a BP of, let's say, 80 over this, and the doctor has prescribed, let's say, a beta blocker or a calcium channel blocker or whatever. You know, like, how can you properly assess 60 patients and everybody is on an antihypertensive? How can you check everybody before that? So you are not able to assess. So it leads to shortcuts, which can be unsafe. There was one thing that he said that was so funny. He said that he was going for day shift, so he asked the night staff that who are the diabetics, because they asked them to check the insulins for the diabetics in the morning when he came. And then he said that the night nurse said she did not know. She said, how can you not know the diabetics? Because, you know, with diabetics, they can easily go south.
We're passing each other, and I don't know, this guy's clueless. He comes up to me, hold up. Are you the nurse? Can I give a report? I was like, no, I'm on training. I'm like, whoever the name is of I'm supposed to be shadowing tells me I'm supposed to do the blood sugars. And it's like, oh, I don't know who the blood sugars are. And then I asked him, hold up, weren't you the night nurse? I'm like, what were you doing this entire time if you don't know who the blood sugars are? I'm like, gosh, let me not bring my parents or anybody to this nursing home, because this nursing home is crazy right now. And he goes, it's different between night and day. So I was like, oh, okay, I didn't know that miraculously their diabetes get cured at night and it comes back during the day. So I was just trying to figure it out. Like, what's that, type 4 diabetes? It just disappears at night, so you don't have to worry about their...
You know, especially the insulin dependent ones or the type 1s, like they can quickly go into hypo, which can be fatal, or they can go into DKA, right? So you have to know. You made a joke like, do they have type 4 diabetes where their diabetes gets cured at night? How come you don't know? Because you're a night nurse, you don't know who is diabetic. But it's because there's so much to do, they don't even keep track of those things. And I understand why all those things can make the care home a bit unsafe to work. That is why you have to report if you think you're short staffed, if you think that people have more needs and then you need more staff, you have to report, you have to send emails so it can be a track of all of these things. And another thing that he said that really struck me was the nurses, I think they left. The nurse from the previous staff left and they handed over the keys to him, and then they told him, and he was new, he was starting his induction that day in the nursing home, and they left the keys with him and then they just left.
I was like, okay, I'm here for orientation. And the night nurse was like, oh, okay. And after 15 minutes, they're like, hey, so the nurses never showed up, so we're gonna go. I'm like, oh, okay, what do you mean we're gonna go? Like, yeah, we're gonna go. We're just gonna leave the keys right here with you. And I looked at them like, huh? You mean the narcotics keys? Like, yeah, we'll just leave it right here. They'll be here shortly. And guys, that was egregious, because I'm not used to that, guys. Like, you can't just leave.
I learned this the hard way. When I first started working in the UK as a nurse in a nursing home, there was a day that a senior nurse who was supposed to hand over to me left the keys with somebody else. I got it from somebody else. So I thought you can do that. But apparently it is not right to do that. And I learned it the hard way. I also had to go. The nurse who needed to come for me to go was delaying. She arrived so late. I had to go to church or somewhere. So I also just left the key somewhere and I passed the message on. Oh, are you on your way? Okay. I've left the keys here. I got the shock of my life. I was reported to the manager. I was called to the manager's office. It became a whole issue. I'm like, but the in charge did that last week and nobody. Apparently it is very wrong. And to all care home nurses, I'm saying this, you are responsible for the patient until you have properly handed over to the next staff. Keep your keys until the next staff happens, because we are so used to doing that. We do that all anyways, and it can land you in trouble the day that you least expect. Another thing that he mentioned that was also quite troublesome for me was it was his first day and they were willing to give him the CD keys without counting with him, right? And they were going to go as he waited for the staff. That can easily be a police case. You know, when CDs get missing, you need to phone the police. That can easily happen. So with CDs, especially, like, you need to count and count very well. But most of the time as nurses, you're so used to this person, and in the nursing home, you can easily say that, oh, I'm coming back this evening. Don't worry. If there's any discrepancy, call me, right? But we all know that is wrong. And he experienced that. Don't even take the CD keys. No, don't accept it if you're not sure of exactly what is in there and what's that. Can easily become a police case, right? And he also mentioned that in some nursing homes in the US, they are made to hide falls and all of that. And I think I've heard it in another US nurse YouTube video before, because you know that in the US, they hide the falls, right? So that they don't have to send the person back to the hospital, so that the residents will still be in their care, so that they can receive money from the government, you know, because if they send the person to the hospital, it has to do with issues with Medicaid funding and all of that and all of that and all of that. And that is not an issue in the UK and in our nursing home.
Guys, one of my friends worked as a supervisor at a nursing home. You know what happened? Basically, a patient or a resident, you call them residents in a nursing home, fell. Okay, resident fell, pulled up, did the whole supervisor thing. You know, they have to assess and document the fall, whatever the case may be. This guy really was trying to be all bougie, writing the best notes. And you know what happened? The administrator and the director of nursing called him and said, hey, let me tell you something. We're going to need your login. My boy said, what do you mean you're going to need my login? We need your login because we have to change your notes. First of all, Medicare and Medicaid ain't going to pay us. Right? They ain't going to pay us with your notes. Resident did not fall. Okay? Resident declined slowly.
And I will say that what I've learned in the nursing home is that if you hide falls in the UK, you can easily be in trouble. I remember there was a gentleman who fell, right? He got up himself. It wasn't any serious fall. He's not on any blah thing and blah, blah, blah. And it wasn't even me on duty. It was my nurse friend who was on duty. And this gentleman was like, please, don't come and do your neuro ops and all of that. I don't need to be checked. I'm fine. My friend insisted, who was a nurse, insisted, no, I'm going to do what I'm supposed to do. Policy says I have to check you because I was on witness. I have to do neuro ops. I have to do this. I have to do that. I have to do that. I have to do a body map. I have to do this. She went all 100 yards. She did everything. Guess what? There was a fracture on one of the fingers. That was as a result of the fall, but the person did not feel the pain and all of that immediately, so we did not know. There was another day that my patient fell, right? And this person was like, oh, it wasn't a serious fall. I checked the skin, everything was all right. Thank God I reported. I came back to work the next day. The person was blue all over. Some people don't show the immediate signs of bruising, but it develops some few hours later or some few minutes later. Imagine if I had not reported. This person was now telling the whole world I fell and this lovely nurse Nanelle did this and this lovely. Imagine if I had listened to her when she initially said, do not make a report about it. I don't want to be checked every 15 minutes and I don't want to be checked every whatever. You understand? There's no point hiding faults. It will be at your own risk. You will lose your license. So basically these are the things, right? These are the things that make care home a bit more dangerous. But I believe that if you know the laws, if you are confident, if you know exactly what to do if you're not sure, phone the manager, phone the on-call manager, phone out of hours, phone the GP and document every single thing. And then if you are not comfortable taking care of any group of people because you came to work and there's no carer and they're telling, oh, the residents usually sleep well at night, don't worry, don't watch anybody in the morning, don't worry, do not accept it. Do not even take the keys, do not even take the handover, just go home, right? Because you're not comfortable. You will not be penalized for that. They told you it's okay, don't worry, they'll sleep well. You take care of them, something happens, you go to court, you go to NMC, it's a different story altogether. These are the issues with nursing. But let me also say that these things don't happen all the time. Like I said, in the residents in nursing, most of them, they are not acutely ill. Most of them, they are end of life. I'm not saying that because they are end of life, we don't have to. Most of them is just palliative care. We're just managing their pain until, they die peacefully. Some of them is just end of life. We're just making them comfortable and pain-free and then, make them die peacefully. And then with those that have nursing needs, maybe we're just dressing simple wounds or we're just, managing their chronic hypertension or Parkinson's or whatever it is. So it's not that scary, but there could be some scary moments and you should know what you have to do in certain situations and be careful with your documentation and all of that. But I will still vote for care home as a place where you can easily lose your license regardless in UK or US. I thought it was just UK, but apparently US nurses are crying as well. What do you think? So comment below, where do you think you're likely to get your license revoked as a nurse? Is it a private hospital, a government hospital, or the NHS, or is it a care home? What do you think? What do you think? Regardless, anywhere. Let me know in the comment section. Thank you so much for watching. Bye.